Hi everyone, my name is Casie Warkentin and I'm the owner of Geeked Out Exotics and Exotic Medical Supply. You may have already heard of Exotic Medical Supply as we're the company that puts together specialized emergency first aid kits for not only sugar gliders, but other small exotic mammals and reptiles. Today I'm here to talk to you about some of the most common medical emergencies we see with sugar gliders. Before I get too deep into this discussion, I want to clarify that I am not a veterinarian or a licensed vet tech. I am an owner who has had personal experience with a wide variety of illnesses and injuries. This information should never replace a visit to a licensed veterinarian for proper assessment and continued care. Rather, the information I'm going to share with you today is comprised of experiences with my own gliders or gliders of owners I've worked closely with who were seen by veterinarians for proper medication and treatment. Today we're going to discuss several types of injuries as well as some of the common tools to help your glider both before and after a vet visit. First, let's talk about emergency first aid kits and why it's crucial for you to have everything in one place. Let's face it, when we discover an emergency, it's often stressful during times when the vet offices may be closed, and frankly, it's overwhelming. Even when I see an injury or issue that I've dealt with time and time again, I still find my heart racing when I find that injury for the first time. When we're in a highly emotional and stressed state, it's really easy to forget simple things that we already know. Having all of your supplies in one location will not only help you to save time when responding to an issue, but it'll also reduce stress since you won't be spending your time trying to find everything you think you need just to find out you're missing something halfway through handling the problem. I like to recommend keeping smaller amounts of a wider variety of first aid supplies on hand as well. The main reason is you'll waste more money buying full-size products when in all reality, you may not ever need the product or you may only use a very small amount of that product before it expires. This is one of the reasons why the exotic medical supply kits have small single-use products in them. Some products such as sterile saline or lactated ringer solution may be available to purchase from your veterinarian depending on your level of expertise and comfort. Any additional fluids, medications, or supplies that you do purchase need to be stored properly. Always be sure to check expiration dates before using any products on your sugar gliders. Always work very closely with your vet each time you feel like you need to use any of these products to assure that you're using the products properly. And keep these products with your emergency first aid kit unless the product requires refrigeration or special storing conditions. Now that we've discussed why it's important to have everything in one location, let's start talking about medical issues you may run into as a sugar glider owner. One of the most urgent issues I've personally encountered is a dehydrated sugar glider. This is an emergency situation. Some of the symptoms of a dehydrated glider can include a lack of energy, loose skin that stays tented when it's pinched gently between the shoulder blades, sunken eyes, abnormal breathing, and even seizures. There are a wide variety of reasons why a sugar glider can become dehydrated. Water bottle malfunctions, not taking in enough water and fluids, illnesses, and more. So depending on the severity of the dehydration, it can be very difficult to rehydrate a glider fast enough with just oral fluids alone like Pedialyte or coconut water. Personally, I've had sugar gliders who were only mildly dehydrated, as well as sugar gliders who were so severely dehydrated that they required multiple subcutaneous injections. In the case of only mildly dehydrated gliders who are still bright, perky, alert, whose skin only barely stays up when pinched, I have given them unflavored Pedialyte. The reason we give an electrolyte solution is to help restore not only the lost fluids, but the lost electrolytes in the body. Having a sugar glider drink just plain water will not replace the minerals such as sodium, potassium, calcium, and chloride, which are all crucial in several body functions. While coconut water can potentially help in mild dehydration situations, it's important to note that Pedialyte, as well as fluids such as sterile saline and lactated ringer solution, are specifically formulated to replenish sodium, glucose, and other necessary electrolytes for dehydration. Now, when it comes to cases of severe dehydration, especially if a sugar glider is seizing, it's important to immediately get to an urgent care vet. At that point, every minute counts. Make sure you have a couple of backup vet options in case someone can't see you. Even if a vet is not an exotic specialist, veterinarians can oftentimes still give subcutaneous injections. So don't be afraid to reach out to any urgent care vet clinic if you can't be seen at your own normal exotics vet clinic. I also strongly recommend to owners that they work with their veterinarian and the vet staff to teach them how to properly give subcutaneous injections, if possible. So worst case scenario, you have the choice to give the correct fluids yourself, just long enough to get the sugar glider to a veterinarian. Consider requesting a technician appointment so staff can assist you as well as watch you perform an injection in a non-urgent situation so you can become comfortable and confident with this process. Giving subcutaneous fluid injections can and usually is intimidating when you're in an emergency situation. It'll take a bit of time to become comfortable with this, so having a good working relationship with your veterinarian office can make a massive difference in how you respond to the situation. Sometimes this can be the difference between life and death depending on the severity of a sugar glider's condition. The biggest reason for vetting a sugar glider who is dehydrated is to not only prevent their body from failing due to dehydration, but to determine the initial cause of the dehydration so it's properly addressed to prevent repeated occurrences. Now let's talk about some injuries that you may see as an owner. It's not uncommon for sugar gliders to get injuries like a scratch from a toy or a toenail, a mating or dominance wound from a fellow cage mate, or other small lacerations. Personally, I've had to deal with injuries as small as a nail scratch to as large as a lacerated chest wound that required surgical revision and 2 months to fully heal. When dealing with a wound, depending on the size, it's also important to keep in mind you may also be dealing with factors like shock, blood loss, dehydration, electrolyte imbalances, malnutrition, and most importantly, pain. According to Dr. Sonia Hernandez-Divers in her article published in the Veterinary Clinic's Exotic Animal Practice titled Principles of Wound Management of Small Mammals, Hedgehogs, Prairie Dogs, and Sugar Gliders, attempting to treat a wound without simultaneously addressing these factors can lead to wound treatment failure. For example, sugar gliders are prey animals and they oftentimes hide the level of pain they're in. Not properly assessing and treating pain for a wound can lead to a variety of complications, including a glider trying to remove the problem through self-mutilation. From personal experience, if a sugar glider has a small scratch, I will use an antimicrobial or antiseptic solution such as Vetricin Plus spray to help clean that area, and then I'll watch carefully each day to ensure that the glider isn't showing any signs of infection or pain. Let me emphasize this would not be the case with certain scratches such as a scratch of the eye. Any issues with eyes, respiratory systems, and seizures should be addressed immediately by a vet. For open lacerations, like you would see from a mating or dominance wound, it's important to evaluate the severity of the injury as well as seek veterinary care. Personally, when I find a sugar glider with an open laceration, I immediately separate that glider from its cage mates. I do this because cage mates will sometimes groom their injured cage mates, reopening a healing wound or even making a wound worse than it originally started. I also look for active bleeding. Gliders have a small volume of blood and can't afford to lose much blood before it becomes detrimental. As long as there was an active bleeding, I would use a small amount of Vetricin Plus or other antimicrobial spray to help reduce the risk of bacterial growth. As a rule for wound healing, it's important to keep the area clean and dry. There are exceptions where moisture is important, but you want to keep the area clean to prevent bacterial buildup and necrosis of tissue. I have temporarily used sterile gauze pads that have been lightly sprayed with Vetricin Plus antimicrobial spray on a wound to help keep debris and other bacteria from getting into it. However, it's important to note that if you're going to use gauze pads, they have to be changed frequently, multiple times a day. This will prevent the gauze pad from sticking to the granulation tissue that the sugar glider's body is creating in order to heal, as well as prevent conditions where bacteria can grow. Depending on the wound, some veterinarians will choose to keep the wound open to allow for drainage and to prevent trapping bacteria inside of a wound. The majority of our experience with large wounds have involved some sort of opening for drainage, whether it was stitched or left open for secondary intention healing. Secondary intention healing is when a wound cannot be surgically closed with sutures and requires the wound to heal from the bottom up through granulation tissue, contraction, and epithelialization. Now let's talk about abscesses. Gliders, like any other animal and human, are prone to abscesses. You've probably seen the pictures in different sugar glider groups, especially of facial abscesses on gliders. Facial abscesses are an issue I stress is an emergency for a couple of reasons. First, there is very little room structurally for that pressure to build up before it can impact breathing. Second, that buildup and swelling can put pressure on the eyes, which can potentially damage the eyes. This is not a situation where you want to wait a week or a few days to deal with. Abscesses can quickly grow overnight, so getting your glider into the vet the same day or the next morning at the latest is very important. It's best to assume abscesses on the face are dental until proven otherwise when they're under the eye and the cheek. So that means that your vet will want to possibly lance, drain, and culture the abscess in order to ensure the glider ends up on the correct medication for the species of bacteria they're dealing with. In addition to the antibiotic and pain meds, your vet will likely recommend x-rays to rule out a broken tooth or a tooth root problem that would require extraction to prevent repeated abscesses. If you're dealing with an abscess that has opened up while you're at home, gently clean the area with sterile gauze with an antimicrobial spray like Metricin Plus. If your glider is scratching at the area or causing more damage, it may be necessary to use an e-collar if possible while you seek out veterinary care. Now, occasionally you may come across a sugar glider who gets a hair or thread wrapped around toes, hands, or feet. Most often, this is due to sugar gliders chewing holes in pouches or cage sets, exposing the threads. This is one of the main reasons we encourage owners to avoid mass-manufactured cage sets and use sets that were made safely with hidden seams. Some of the biggest complications that can happen with threads and hairs wrapped around appendages is cut-off circulation, pain, tissue damage, and tissue death, as well as gliders mutilating to free themselves from the thread. It's important to be very delicate and deliberate when you're handling issues such as this, and it often is more helpful to have a second pair of hands to work more effectively and safely for you and your sugar glider. With something requiring extra time as well as precision, I generally opt to burrito wrap my glider to help keep them contained as well as protecting my own hands. A pair of needle-nose tweezers as well as thin, sharp scissors can help cut and loosen tightly wrapped threads. If you choose to attempt to remove the threads yourself, you should consider using magnifying glasses to get a clearer view of how much thread is there, and you'd want to work slowly so as not to further constrict any tissue. It is possible that threads will cut into the skin and tissue it was wrapped around. Because of this, it's important for a vet to assess any damaged tissue to make sure it's properly cleaned. It's also crucial to ensure that the tissue isn't so damaged that the paws or toes could become necrose or require an amputation. If the vet advises it, you can sometimes provide hydrotherapy at home to help with circulation with this injury recovery. While we're on the subject of paws, let's also talk about injuries as simple as cutting nails too short. The nail is made up of the harder keratin-based layer of the nail along with the quick, which is made up of nerves and blood vessels. Occasionally, we as owners can accidentally cut a nail too closely to the quick, causing it to bleed. In other cases, gliders can sometimes rip their nail away from the nail bed, causing it to bleed as well. In either of these cases, Pender Veterinary Center recommends owners apply a styptic-like powder, such as flour or cornstarch, to encourage the blood to clot. Also apply direct pressure to the nail to help stop the bleeding. If the bleeding doesn't stop, immediately contact your veterinarian. While dealing with nail problems is relatively straightforward, conditions like seizures are not as obvious. There are a variety of causes for seizures in sugar gliders: hypoglycemia, hypocalcemia, dehydration, infections or diseases, and neurological conditions including stress. Because there are so many potential causes, it's important to get your glider to the vet as soon as possible to run tests. Seizures can include symptoms like muscle twitching, drooling, convulsions, clenched jaws, clenched paws, lethargy, and slow visual reaction times, that kind of lights on but no one's home look. To help keep your glider as stable as possible while traveling to the vet, you can provide extra fleece or put them in your shirt to warm them up if they happen to be cold. You can rub Caro syrup or honey or maple syrup directly on their gums with a Q-tip in cases where a glider is experiencing hypoglycemia. Offer high water content fruits and veggies like watermelon, grapes, cucumbers, or apples for dehydrated gliders. And you can also offer a 50-50 mix of unflavored Pedialyte and water, or use 100% coconut water to help rehydrate while you're getting to the vet. If you give oral fluids, you need to be extremely careful and go slow with small amounts. If a glider starts to seize, you don't want to accidentally aspirate a glider or overload them, which could cause much bigger issues than what's already happening. Also, keeping track of how much fluids or how much food you give your sugar glider so you can report that information to your vet during the urgent care visit is necessary. I cannot emphasize enough that seizures are an absolute must-vet situation, and you must vet them as soon as possible to determine the cause as well as prevent long-term damage. Now, owners of male sugar gliders should take special care to make sure they're watching their male gliders' reproductive health. Yes, I am talking about the penis. Male sugar gliders are no different than pretty much males of any species. They'll try to mate, they'll play with themselves, and they'll find reasons to use that extra appendage. Because of this, they're at risk of injuring their penis. Some of the common issues you can run into would be things such as a bite or a scratch wound from the meat, a painful spot from playing a little too hard, urinary tract infections, bacteria, yeast buildups, or irritation, swelling, and dryness from the penis being exposed for long lengths of time to air. If you notice your sugar glider's penis not retracting for long lengths of time, like more than an hour, if it seems dark red instead of that nice pink, or if it is looking black or brown, you're going to want to get your glider into the vet immediately. These are signs that the penis may have suffered damage that could leave it at risk of necrosis that would potentially require amputation. This isn't to be confused with a male with an erect penis that may be red and stiff versus damaged and necrosed tissue. If in doubt, lube it up and immediately consult your vet. We had a breeding male Godric who was notorious for penile injuries. When Godric's penis was left out for long lengths of time, we would rub a cold Q-tip on it near the cloaca to see if he would retract it himself. If he didn't retract it for more than an hour, or if his penis seemed darker or inflamed, we would rub a water-based lubricant on his penis in order to keep the tissue from drying out. The longer the tissue is exposed to the air without lubrication, the higher the risk of penis necrosing. This was something that we had to do multiple times throughout the day while we were trying to get in for veterinary care and even post-veterinary care. One reason, though, that it's important to not just treat with sterile lube at home and to have a veterinarian look over the penis is because there could be damage to the blood vessels or the urethra, and damage to those structures can lead to continued complications. Your vet will likely prescribe an anti-inflammatory pain medication along with an antibiotic, and depending on the extent of the damage, your vet may opt to amputate part of the penis. Another reason is that there could possibly be underlying conditions causing irritations like urinary tract infections, bacteria, or yeast buildup that can cause discomfort when a male retracts his penis, so he leaves it out instead. Another injury that sugar glider owners may come across are traumatic injuries to arms, legs, or tails. Injuries can range from a small scratch from another glider grabbing a tail or a limb, a fractured or broken bone due to a fall or underlying conditions like metabolic bone disease, a degloving injury from unsafe wheels, or even self-mutilation injuries caused by the gliders themselves. For more severe injuries, the sugar glider may also be showing signs of shock from pain or blood loss. While a small scratch may seem like nothing, that small scratch can sometimes turn into an abscess or a painful area that the glider can hyper-focus on and either overgroom or mutilate into much larger wounds. No matter how big or small the injury may seem, it's important to have a veterinarian check to assess the proper care for that particular injury. While tails can sometimes be temporarily covered by large boba straws, this can be difficult to keep on, and they should only be used for short term as you seek out vet care for your sugar glider. Smaller open wounds can also temporarily be covered with sterile gauze and vet wrap carefully so as not to restrict blood flow long enough for you to get to an urgent care vet. One of our gliders, Xander, was healing from a large chest wound for more than a month when he started to attack his tail. He was in an e-collar at the time, but between the depression of being alone, the restriction of jumping and playing due to the area and the size of the chest wound, and the frustration of having to have an e-collar on every day caused him to self-mutilate. In order to help stabilize him until the next morning when our vet would perform a partial amputation, I cleaned the area with some sterile saline solution. I sprayed it with Vetricin Plus antimicrobial spray to prevent bacterial growth. I put on a clean gauze pad, and then I gently wrapped the tail with vet wrap. This was on for a few hours, just long enough to get him to the vet the next morning. It's worth noting that improper splinting can create even larger problems, so it's important to allow your vet to get x-rays and a hands-on exam to ensure splinting is done properly. Now, for owners of female sugar gliders, it's important to know what mastitis is and what to look for. The Oxford Dictionary defines mastitis as the inflammation of the mammary gland in the breast or udder, typically due to bacterial infections via a damaged nipple or teat. The Merck Veterinary Manual adds that acute mastitis can cause anorexia, firm, painful, and warm mammary glands, fever, and decreased maternal interest in its offspring. While overall treatment needed is a broad-spectrum antimicrobial treatment, such as Clavamox, owners can use warm compresses on the swollen gland to try and help relieve pain short-term, as well as stimulate a milk letdown reflex to improve milk flow. But be careful that compresses aren't too hot. Untreated mastitis can lead to abscesses, permanent gland damage, and serious systemic illnesses like sepsis. In addition to antibiotics, your vet will likely prescribe anti-inflammatory pain medications. So it's really important in those cases to get to a vet. With some of the situations we've talked about already, and with a few more we haven't discussed, you may find yourself needing to use an e-collar or an e-jacket. An e-collar is a small cone, either plastic, paper, silicone, or foam, that can be put around the neck to prevent a glider from reaching or further damaging an injury. An e-jacket is either made up of vet wrap or fleece with elastic. Both styles are designed to prevent a glider from being able to bend over to reach surgical sites on the lower body or tail. It can also prevent a glider from trying to interfere with wounds on the back or chest. Keep in mind, both e-collars and e-jackets are typically intended to be short-term use with frequent supervision. Be diligent with checking on them regularly to make sure they continue to stay safe and don't get snagged or stuck on something. Gliders are also notorious for escaping e-collars and e-jackets, so checking on them frequently will help you catch problems early before they have a chance to cause even more damage. Occasionally, there are situations where a glider may need to be in one of these two items for a length of time. Again, going back to Xander was healing from his chest wound. We couldn't put an e-jacket on him due to the location and size of his injury. That meant we had to keep him in an e-collar to prevent him from re-injuring himself. He spent the first 2 weeks in a plastic satellite e-collar. Over time, e-collars can and most likely will irritate the skin around the neck, cause the fur to be rubbed off, and just be irritating. This is exactly what happened to Xander. Because of this, we switched him to a silicone e-collar for the next 2 weeks, with free periods of supervised time out of the e-collar. Unfortunately, due to the stress of the situation, he managed to maneuver the silicone e-collar in a way where he could reach the very tip of his tail. He then mutilated the tip of the tail, requiring a partial amputation. After speaking with our vet, the difficult trade-off we had to weigh was keeping the e-collar on to protect him from continuing to cause further damage, but that was also affecting his mental health, which caused him to want to self-mutilate even more. Once Xander's chest healed, and because he reopened his suture site after his partial tail amputation, it required a revision tail amputation surgery. When this happened, we switched him into the e-jacket so he could no longer reach the surgical site and allow it the proper time to heal, knowing that it was not going to cause further damage to the chest injury that had been healing. It's important to note that if you're using an e-jacket and it's covering a wound, you will need to keep that area clean and dry. As we talked about with lacerations, gauze and bandages need to be changed in order to prevent bacterial growth and infection, and this has to happen multiple times a day. The last thing I'm going to talk about is warming up a cold sugar glider. It can be deadly to warm up a hypothermic sugar glider too quickly because of the sudden drop in blood pressure. If you come across your glider and he or she is cold, you will still want to warm them up as quickly as you can in a safe way. One of the easiest ways to do this is simply putting them up against your bare chest inside of your shirt. You can use extra fleece blankets to help with warming them while they're in your shirt. Another option is to use hand warmers. You have to be very careful with hand warmers because 1, they heat to a very hot temperature for sugar gliders, and 2, they can reheat a sugar glider very quickly. It's important not to put your sugar glider directly on a hand warmer or a heating pad. Make sure that there are a couple of layers of fleece on a hand warmer or a couple of layers of fleece or a towel on a heating pad. It's critical to take your glider in immediately to determine why your glider is not regulating his or her temperature. There are generally too many variables to determine with confidence what is going on at home. So thank you all for your time, and I hope this information will help empower you if you find yourself in a situation where you need to respond to an emergency. One of the most comprehensive sugar glider specific first aid kits you can find is our exotic medical supply kits. It contains most everything you could need in an emergency situation, including 3 styles of e-collars, all 3 sizes of e-jackets, a full-size bottle of Vetricin Plus antimicrobial spray, and much more. You can get your exotic medical supply kit today at our website at geekedoutexotics.com. And don't forget to follow Exotic Medical Supply as well as Geeked Out Exotics on Facebook, Instagram, and YouTube. Thank you so much for joining, and I hope you have a wonderful day.